Hi, I'm Tom Twiss, a member of Pittsburgh Green New Deal, and I'm here with Dr. Claire Cohen. Dr. Cohen is an African-American child and adolescent psychiatrist who has been practicing in the Pittsburgh area since 1984. In addition to her career, Dr. Cohen has always been very active in her community. Recently, she's been involved in efforts to stop the school-to-prison pipeline in the Pittsburgh public schools. She's a founding member of Pittsburgh Green New Deal. She's on the advisory board of the Pittsburgh Black Workers Center, and she has been fighting for Medicare for all as a member of Physicians for a National Health Program, the Western Pennsylvania Coalition for Single-Payer Healthcare, and National Single Payer. She is also on the Medicare for All Committee of Democratic Socialists of America. Claire, thanks for joining us today via YouTube and Zoom.
Thank you. I'm really excited to be here and talk about the medical and racial aspects of climate change.
Claire, we often think of climate change as something that's going to affect us in the future, but is climate change already affecting our health in the Pittsburgh area? And what can we expect to see if the situation is not addressed?
Well, because of historic industries of Western Pennsylvania, we've actually been experiencing climate impacts on air, water, and soil quality, leading to health effects for decades. But now with the weather pattern changes and other effects of climate change, those changes are accelerating as well as multiplying. We already have one of the highest national incidents of asthma and obstructive lung diseases in the country. With changes in temperature patterns and increased flooding, we are also seeing a lengthening and increasing severity of the spring and fall allergy seasons, an increase in tick-borne and mosquito-borne diseases, as well as other waterborne diseases and mold-related illnesses due to the toxins and contaminated flood and groundwater. In addition, we can expect an increase in heat-related deaths and illnesses, which includes an increase in heart attacks, and an increase in other illnesses such as cancers, developmental disorders, birth defects, infertility, and dementia. These are all due to exposure to increasing toxins in the air, water, and soil. Also, we're seeing an increase in car accidents due to more hazardous driving conditions due to things such as flooding and severe snowstorms. If climate change is not addressed, all of these are going to get increasingly more severe and more frequent.
Claire, we know everyone is affected, but is there really a disproportionate racial impact? And if so, why is that the case?
Okay. So due to the disproportionate poverty in the Black community, the segregation of neighborhoods, and the types of jobs that Black people in Pennsylvania tend to have, including Black people in Allegheny County, the African-American community tends to bear a disproportionate health impact of climate change. First, low-income Black communities are more likely to live near high traffic areas, big highways, things like that. So that's an immediate cause of increased exposure to air pollution. Second, power plants are known to produce some of the highest levels of ozone and particulate matter in the country. In Pennsylvania, 85% of power plants are located in neighborhoods that are disproportionately low income and disproportionately Black. Low income Blacks are twice as likely as low income whites to live near power plants. Because of these two factors alone, the high traffic and the power plants, Black children in Allegheny County and Philadelphia have the highest rates of asthma in the nation. In 2019, over 29% of Black children in Allegheny County had asthma. That's more than 4 times the rate of white children. So when I tell people these figures, they often say, well, what can we do about this situation? And 3 things immediately come to mind. First, we have to make sure that representatives of the Black community are always there at the table at every level of the process, from planning to implementation to public hearings. We need to make sure, because the Black community can best represent itself, that representatives are there. Second, when we are looking for groups to join to fight the climate change, we need to look at groups like Pittsburgh Green New Deal that have a commitment to equitable representation of all of our citizens. And finally, we need to support efforts that target resources to the resource poor, Black and low income communities. So I think if we do those three things, we'll go a long way to addressing the inequities in impact of climate change.
I've heard there are even mental health aspects of climate change. As a psychiatrist, can you say more about this?
So the existential threat of climate change has caused a significant increase in anxiety and depressive disorders worldwide, not just here, especially in people under 30. A 2021 study at Bath University in England looked at 10,000 young people between the ages of 15 to 25, I think, around roughly that, in 10 countries around the world, including the United States. And they found that over 60% of adolescents and young adults in those countries experience anxiety related to their fears about climate change. And that even if you looked at those who feel they can't depend on their government to help mitigate this problem, the percentage went up. In addition, with the increase in catastrophic events leading to devastation and trauma, we're seeing an increase in PTSD and in bereavement. Bereavement is when someone close to you dies and you're in grief. And we're seeing an increase in those around the world.
Finally, I know you're a big proponent of universal public single-payer health care in the United States. Is there a connection between the fight to address climate change and the fight for Medicare for all, and specifically the current fight to stop recent efforts to totally privatize Medicare?
So with the deteriorating health care of Americans, and we know that our lifespan is actually decreasing in the United States, something unheard of for a superpower wealthy country. Our lifespan is decreasing, and we've attributed some of that to COVID, but actually some of that will increasingly be due to the deteriorating effects of climate change. So with our deteriorating health, which has been documented, we can expect an increased need for quality healthcare service and an increased need for access to healthcare. I mean, that's a no-brainer. There have been decades, as you know, the United States is one of only a couple of developed nations that doesn't have some form of public, comprehensive universal healthcare system. Our system is distinguished by being privatized and fractionalized, and it's fractionalized mainly due to that privatization. So what's been the impact of that? Decades of studies have shown that the drive for profits presents a fundamental conflict with the goal of providing comprehensive, quality healthcare for individuals and for society at large. So one example is that over the past 8 years, private insurance, Medicare Advantage companies which only use 85 cents of every dollar for direct patient care, have cost the Medicare Trust Fund $106 billion more than traditional Medicare, which uses 98 cents of every dollar for patient care. And now, since Trump, there's been this effort to bring in private equity and venture capitalists as middlemen to manage healthcare, with the agreement that they would only have to pay 60 cents out of your Medicare dollar for your healthcare. So now that is, and that's continuing to proceed under Biden, we can predict that people are going to have less quality health care, more expensive care, meaning they're underinsured and can't pay for it, and that healthcare at a time when we need, due to the devastating impact of climate change on health, at a time when we need to ramp up our healthcare system, we're going to be providing more costly and less quality healthcare that is less universal and covering less people. The U.S., because of its privatized healthcare system, had the worst COVID healthcare statistics in the world and has among the worst healthcare statistics for the 30-something developed countries. We're the worst in terms of lifespan, infant mortality, maternal mortality, and so on. So if we want to be prepared to address all the health impact, we need to ramp up our system by making sure it can cover everybody without breaking them financially. The analogy I like to use is the analogy of a burning house. If your house is on fire, it doesn't matter if you're rich or poor or black, white, or brown, you need the fire company to come and put it out. And the problem isn't just devastating for you if you're not able to call the fire company because you can't afford it because it's private or because of racial discrimination. Because if your house doesn't get put out, the whole community could burn down. And if or like in the Chicago fire, the whole city could burn down. Or in the case of climate change, the whole earth could be devastated. So we need to think of this as a public good effort. We need to think of both the efforts to address climate change and the efforts to provide universal health care as public good efforts that must and need to happen if we are to survive, save our country, save ourselves, and save the world.
Thank you, Claire, and thanks for everything that you've been doing on all these issues. Thank you.